medical matters now, because a new test for bowel cancer is getting a lot of people very excited. Apparently it could save around 3,000 lives a year. We're going to be talking about this after we show you this film, because the NHS has been given the go-ahead to use this examination. It will be offered to everyone in England if you're aged between 55 and 64, and it allows doctors to search for and remove small growths. No, we're not going to have a film. We're going to go straight to the guest now. And the guest is with me now, Dr. Gemma Newman. Dr. Newman, who is that age group there that we're talking about has been offered free screening? Who is the most likely to contract bowel cancer and why?
Well, bowel cancer is a pretty prevalent condition. You've got around 40,000 people a year that develop it, and of those, around 16,000 unfortunately die from it. And the people that have bowel cancer usually, it can develop around about middle age, up into sort of your 60s. Although if you have a genetic tendency, you can get it from as early as 20 or 30.
Right. Right. So it's interesting. A lot of people may look at this and say, how can we afford in a cash-strapped NHS to offer a service like this? But I suppose at the moment, not detecting it, and you're talking about the thousands of deaths every year, must cost an awful lot of money.
Well, that's right. I think the projected figures are around about a £60 million investment into providing flexible sigmoidoscopy to patients from the age of 55. And that's over 4 years, I believe. But as you say, comparing that to the cost of having an undiagnosed bowel cancer, which then has to be treated at a much later stage, can be a huge problem for the NHS and for also the families involved.
Now, is this a respecter of sex? I mean, you said basically if you're over 50, you're in the risk zone there, 50 to 65 or so. More men than women, or is it equally applicable?
Well, the screening programme is going to be rolled out for men and women. In the past, I think it's been something that people are more aware of men having, but actually it's fairly equal. And
the difficulty, I suppose, for you as a doctor, or anyone who has it at all, is it's one of those embarrassing illnesses, is it not? What are the symptoms people should be looking for?
If you've got anything like a change in bowel habit, blood in your poo, black poo, weight loss, or any new abdominal pain, then that's when you should go and see your doctor. But it's important to stress that this new flexible sigmoidoscopy screening test is actually a screening test for people without symptoms.
What is so exciting about this? Because presumably there is something, I think it's called as a colonoscopy or something, which basically involves putting a camera up your bottom.
Essentially, that's exactly what they're doing.
So is this a smaller camera, or what is different about this one?
The difference is the amount of preparation involved and the amount of bowel that you see. So with a flexible sigmoidoscopy, you're looking at the rectum and the lower third of the colon.
Yes.
Whereas with a colonoscopy, you're looking at the entire colon, ascending, transverse and sigmoid colon. This is just 1/3 of the colon, the lower third.
Yeah.
The reason for that is because most of the cancers that are detected at this early stage are in that third of the colon, and also it doesn't require as much bowel preparation. You'd need an enema or a laxative.
Meaning what? Clearing your bowel.
Yeah, exactly. You'd need an enema or a laxative for a flexible sigmoidoscopy, whereas if you're having a full colonoscopy, you need to have a liquid diet.
And when are we likely to see this? When is this screening likely to come in?
It's not yet clear exactly what the timescale is going to be, but I know that the Department of Health is hoping to roll out a pilot for people aged 55 and then continue to offer them the normal blood test stool sample, as is the screening at the moment.
Well, Gemma, thanks for raising a lot of points with that. We're going to be talking about it again in an hour's time on the programme. If you've got a concern, if you've got an experience of all of this, please do let us know. news@sky.com, at Sky Charlotte, at Eamonn Holmes. That's Dr. Gemma Newman, who is a GP. Very nice to see you. Thank you very much indeed.
Thank you.
And always lovely to see Jackie Beltrao, particularly on this Thursday morning. Something just joyous about today.